just had severe knee pain. It was just a burning pain, and I could tolerate it pretty much during the day, but at night when I went to sleep, it would just wake me up and it would just hurt, and I'd get up and walk around to try to see if I had my knee in one position too long, but it just didn't get any better. So I just said, well, it's time to take the trip to see Dr. Berman.
Nancy came to see me in August of this year, and she was having pain in her knee, mostly through the medial side, inside, and she was experiencing this discomfort and had been for several months. So we examined her, and we thought initially she was simply having a torn cartilage or a torn meniscus. So we ended up doing an exam and then an x-ray and eventually did an MRI. And her MRI showed that not only did she have a tear of the meniscus, but she also had some significant arthritis on the inside half of her knee. She ended up opting for what's called a half of a knee replacement, or a hemiarthroplasty. And that's where we went. Hemiarthroplasties, or unicondylar arthroplasties, actually replace only that part of the knee that's damaged because of arthritis in many cases. And so you only damage the injured area, and the rest of the knee is maintained. The conformis prosthesis is built off of a CT scan. And the CT scan identifies the various dimensions of the knee. So the advantage of that is that we can build both the components of the knee replacement to fit the patient exactly, and also we can build the cutting jigs. One of the advantages of the conformis knee is that it perfectly aligns with the anatomy of the knee. The balance of the knee and the ligament balance of the knee are all specific to the patient and match the patient's natural anatomy correctly.
I was an outpatient, so when I got to the hospital, they told me what time to be there, and Dr. Berman showed right up. There was no waiting. I mean, got me in, got me out, and went home. It was out, so I did just real good. When you have a lot of faith and trust in your doctor, and they make it easy, that's a big comfort right there. Today I'm doing great, and tomorrow I'll even do better.